This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
Well, if you're checking this podcast out, you're probably suffering from back pain. Good news for you. There's new technology for spine surgery. It's called the ExcelsiusGPS. So what is it? How does it work? And how can it benefit you? Well, let's find out with Dr. Stephen Shopler, an orthopedic spine surgeon in Bakersfield. Dr. Shopler, it is a pleasure to talk with you. Thank you so much for your time. So first off, can you give us a brief history of spinal surgery over the years?
Spine surgery has been done for decades in the United States for treatment of curvature of the spine and degenerative conditions. Back in the 50s and 60s, when spine surgery really became popular, there were no implants that we put in the spine. People used to just place bone graft adjacent to the vertebrae and hope that the vertebrae would fuse together to keep them lined up properly. That worked poorly, but it worked on occasions. Then along came the Harrington hook instrumentation, which were special hooks that engaged the vertebra, and that was an improvement over no instrumentation. It held the spine more rigid, but the problem with that instrumentation was it became dislodged if the patient would cough or sneeze or twist inappropriately. Then came the 80s and 90s when we started to develop the use of screws that engaged the vertebra, and the screws secured the fixation much better and helped line up the vertebrae much better. But the problem with the screws was it's very hard to place them in exactly the right position. It's a very small target to hit. And now we have computer-navigated instrumentation and the robotic instrumentation, which really improves our accuracy in placement of these screws and allows us to get a more natural alignment of the spine when we're completing the surgery.
That is quite an evolution of spinal surgery. And as you said, this has now led us to the Excelsius GPS. And can you explain that to us?
The Excelsius GPS is a new robotic assistive spine surgery system. It's made by Globus Medical Corporation, and it's a very sophisticated device. What it does is you load into the robotic memory the preoperative images of the patient's spine. And so the robot memorizes all of the anatomy of the patient's vertebrae. And then during the surgery, the robotic arm assists in lining up the placement of the screws and implants that we have to deliver so accurately.
So you already have a complete roadmap of exactly where to go before surgery.
That's correct. And it's very useful because the robot knows every millimeter of the patient's anatomy, and it allows us to very precisely place these implants that we're using.
So are there different types of spinal procedures that really benefit from the Excelsius GPS?
Currently, we're using the GPS system for spinal fusion surgery predominantly. And in that type of surgery, we're placing screws in the vertebra to anchor them securely and then adding some bone graft along the side or between the vertebrae. And it's mostly now used for spinal fusions. It will be useful in coming years, very soon, as a matter of fact, for placement of other devices in the spine, such as, for example, artificial discs and interbody implants that help stabilize the spine between the vertebrae.
With these types of developments, there's often a benefit to the surgeon and the patient. So first off, what is the benefit to the surgeon/care team?
I think the benefits to the patient and to the surgeon are all in the same category. For one thing, the robotic assistive system allows us to place these implants with greater accuracy. There's a very minimal error associated with the placement of the implants, and according to recent studies, the robotic assistive device is more accurate than even experienced spinal surgeons in placing these devices. The second advantage is speed. The robotic system allows us to place these screws with each screw taking only a few minutes to do, as opposed to about 15 or 20 minutes with some of the more labor-intensive ways of placing screws. The Next thing that it helps with is matching the size of the implants for the exact anatomy of the patient. Remember that the robot memorizes the patient's anatomy. So when we have these screws of various sizes and various lengths and various diameters, the robotic system allows us to plan the surgery with great accuracy. We know exactly the right size of screw, exactly the right diameter of screw. We no longer have to estimate these things like we used to do prior. And then the last thing it does is it really helps us eliminate the intraoperative exposure of the surgical team to the radiation that was necessary when we used to place the screws under x-rays. And that was the way we were doing it until very recently with a live x-ray machine that shoots off x-rays while we're placing the screws to make sure we put them in the right spot. And that exposed everybody in the room, including the patient, nurses, surgical techs, and particularly the surgeon, to a lot of radiation exposure. And the Excelsius eliminates that completely.
So a lot of benefits to both the surgeon/care team and the patient. And then how does this affect the recovery time when using the Excelsius GPS?
The recovery of the patients is very facilitated by the robot because when you're placing these screws, for example, you only have to place them once. You don't have to put them in and take an x-ray and go, oh, I would like it more a little bit to the left or a little bit to the right, and then you have to do it again. And of course, each time you do that, it disrupts a little bit of tissue, and so the patient experiences a little more discomfort postoperatively. I think with the robotic assistive system, it really helps us get this right faster and the first time each time.
I'm sure for someone listening, they're like, I want this robot technology to be used on me. What patients are good candidates for this technology?
Right now, we're using it for spine fusion patients in the lumbar spine and occasionally in the cervical spine when they're having fusion surgeries with screws to hold the vertebrae in place. For patients having simple disc surgery or laminectomy surgery, the robot assistive device really doesn't come into play very much at this time. There will be room for that later, but right now it's for spinal fusions predominantly.
So it sounds like in the future, a robot such as this may be used for other procedures.
I believe so. I think it's important to know that the way the robot works is that the surgeon does the surgery. The robot kind of helps you line up the shot. And the way I usually tell my patients about it is if you're playing golf and you're making a long putt on the putting green, if you had a device that knew every millimeter of the putting green, the device could line up your putt and then you hit the ball. And it's the same way with the robot in surgery. The robot lines up the trajectory for these screws to go in, but the surgeon actually inserts them through the sleeve that the robot is holding. And that allows you to accurately place those screws, but the surgeon still has the feel of how the screws go in, whether you're biting into bone properly or if somehow there's an error and you're not hitting the target correctly.
That is amazing. Dr. Shopler, thank you so much for your time. Last question then. Anything else that you want us to know about this new robotic technology?
I think it, like all techniques, has a little bit of learning curve. And so the first cases one does with it take a few extra minutes to set all the equipment up properly. But within about 2 or 3 cases, we get the sequence down properly, and it really goes right along very smoothly, and it helps us shorten the time of the surgery very significantly. And the most important thing it helps us do is it helps us really achieve a natural alignment of the spine with accurate placement of the implants, something that has always been a goal of spine surgery that we have really refined much better with this system.
We are always interested in better outcomes, and it sounds like the Excelsius GPS helps us with just that. Dr. Shopler, this has really been informative. Thank you so much for your time. We really appreciate it.
My pleasure.
That's Dr. Stephen Shopler, and for more information, please visit dignityhealth.org/Bakersfield/ortho. And if you found this podcast helpful, please share it on your social channels and be sure to check out the full podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.